Please be seated. We begin by asking guests and participants with cell phones to please silence them. I now have the honor to present Dr. Ellen McKenzie, Dean of the Bloomberg School of Public Health, who will preside over her first convocation as Dean.
Thank you so much, Dean, Chief Marshal. I'm the Dean, she's the Chief Marshal. No, seriously, thank you so much, Charlene Douglas, for being here. Graduates, family, friends, distinguished guests, faculty, and staff, welcome to the 2018 Convocation of the Johns Hopkins Bloomberg School of Public Health. I'm particularly honored to be here with you because this is my first Dean presiding over the Convocation as Dean. I want to start with a confession. I absolutely love Convocation. I have been to every Convocation. I was asked to provide proof. I couldn't provide the proof. But I have been to just about every Convocation since the late 1970s when I was a student. I missed a couple, but I just think it's a wonderful celebration. And it's so inspirational to see so many talented students graduate and become the new leaders of public health. As students, you have surmounted immense challenges. You studied, discussed, argued over, and mastered the complexities of public health. But you have not only learned, you have taught. You have taught each other, you have taught your faculty, and you have taught me. I'm impressed by your commitment, not just in the classroom, but in the community. In the past year, you have collaborated with more than 100 community-based organizations throughout Baltimore, contributing 20,000 hours of service, and that's just in Baltimore. You have taken on major issues in public health. You have pursued social justice and equity in health, values we share as a school community, and you pushed for immediate results. And yes, you have held my feet to the fire, especially when it comes to engagement in our community and making our educational programs more accessible and more affordable to a broad range of students, both here at home and abroad. And for that, you have my respect and my thanks. You have upheld the highest traditions of the school. This year marks the 102nd anniversary of our school's founding. And today, we graduate 930 students from 61 different countries. $153 of you will receive doctoral degrees and 777 master's degrees. Of those receiving master's degrees, 329 have earned the MPH, 156 will receive the MHS, 135 the MSPH, 67 the SCM, 25 the MHA, 14 the combined MSN MPH, 13 the MPP, 8 the Master of Bioethics, 1 Master of Arts, and 29 will be awarded the Master of Applied Science, or the MAS degree. The MAS students are the first to graduate from our new fully online program for applied learning. And we're so pleased that 23 of our graduates from this cohort are here with us today. So thank you so much. And congratulations to all of you on your great accomplishments. Now, in addition to you, the graduates, I also want to acknowledge today's other important participants in this event. First, our faculty, distinguished individuals who take great pleasure in being here with you today, sharing this rite of passage, and very much looking forward to collaborating with you in the future as colleagues. So may I ask the faculty on the stage and in the audience to stand up and be acknowledged. Second, and very importantly, we salute the parents, the grandparents, the spouses, the children, the friends of our graduates who have provided moral and financial support both before and during the time at the school. Would you please stand and be acknowledged and accept our gratitude? I also want to welcome and express my gratitude to our Chief Marshal, Dr. Charlene Douglas. She is a distinguished alumnus from our school, earning her MPH and her PhD from the Department of Environmental Health and Engineering. And please join me in thanking Dr. Douglas for acting as our Chief Marshal. Graduates, you have a great reason to celebrate today. But tomorrow, you have a great reason to get to work. One can only look to last week's shootings, sorry, but seriously, one can only look at last week's shootings in Texas or the latest outbreak of Ebola in Central Africa to know that we have a lot of work ahead of us. The people in Baltimore, in your hometowns and home countries need you. They need your knowledge, your skills, and training. They need your commitment, your passion, and very importantly, your optimism. They need you to communicate your science and your discoveries. And perhaps most importantly, they need you to use sound evidence to advocate for programs and policies that are going to make a difference and improve health. Now, admittedly, these are difficult times. Today's polarized political environment has spawned divisions in our communities and a distrust for science. I have just one really important piece of advice for you. Don't get discouraged. You will not be alone. As you receive your diploma and leave this hall, you will become part of a unique network of more than 24,000 public health scholars and leaders working around the world in health service agencies, research centers, NGOs, academic institutions, many of which are led by distinguished graduates of the Bloomberg School. And I should note, and I take particular pride in noting that 3 of the deans of the top 5 schools of public health are graduates of the Bloomberg School of Public Health. So please remember this moment. Remember the person sitting on either side of you. They will be your colleagues for many, many years to come, and they will do astonishing things. Remember the work you have done, and remember what it feels like to be joined with your fellow students in a common cause. And I'm not just talking about surviving biostatistics, but the most important of all causes, protecting health, saving lives, millions at a time. You are now alumni, heirs to a remarkable school with a remarkable history. The legacy of 102 years is yours to build on. The future is yours to make. The world is counting on you. Now I would like to introduce Mr. Justin Jacob, who's the president of the Student Assembly. Justin has been a great partner for me during the first several months of my deanship, and I thank him for that. Justin.
Good afternoon, class of 2018. I want to start off by asking you perhaps a rhetorical question. How many of you, when you woke up today, woke up excited? Excited knowing that you will be coming here to Royal Farms Arena to walk on stage, get your well-earned degree, and then celebrate your accomplishments with your friends and family. I imagine it was all of you, because it's a rhetorical question. But now let me ask you another question. Did any of you wake up today not excited? Well, I too have a confession. When I woke up today, I was not necessarily excited because I was very nervous. Now, where am I going with this? Well, to understand that, we will need to rewind about 2 years back to just after I was elected to be the president-elect and eventually the president of the Student Assembly. Because of my newly elected position, I was invited to Convocation 2 years ago. I sat right there, actually. There was just so much excitement in the air. I was very excited, just like today. When the procession started, the graduates walked in, followed by the faculty, the department chairs, and then finally by former Dean Clegg, who then came up to the podium and welcomed everyone. After his speech, he then introduced somebody I knew. He introduced the then president of the Student Assembly to come up to the podium, this podium, and give a speech to the graduating class. And that's when it hit me. That was going to be me in 2 years, and instantly my excitement dissipated. And that was when the dread took over. My gut began to wrench, and it has continued to do so every time I thought about it since. I'm not trying to be a buzzkill. I have always been scared of speaking in front of people. I never would have imagined being here, for example, in front of almost 2,000 people, standing and speaking. You may think that this speech is actually about overcoming my fears about public speaking, but that's not true. Believe me, I was and still am. If you can see my leg, it's shaking right now. I'm still very scared and anxious to be here right now. So then, if this is not about overcoming my fears, then what? Well, I'd like to remind you how I started this speech. When I asked who was excited to wake up today, and then said that I woke up feeling a little differently than that. This speech is about perspective. For those of you who may not know, I am a 6th-year PhD candidate in the Department of Biochemistry and Molecular Biology, which makes me one of the relatively few basic science lab students in the school. So before getting involved with the Student Assembly, I was immersed in my own little biochemistry bubble, surrounded by people very much like me who really, on a day-to-day basis, only conduct controlled experiments in either test tubes, bacteria, fungi, cells, worms, flies, or mice. Our research and general day-to-day activities rarely directly deal with anything else, such as with people or feelings or emotions. But this all changed when I stepped out of my biochemistry bubble and into this new role in the student assembly. When I stepped out of my cave, which I affectionately call lab. As the head of this organization, I learned that my role was not to necessarily change people's minds, but rather to listen to people, to work with them, to work with you on issues that are important to you, and thus, by extension, because of my position, issues that are important to me. And that way, we can come up with solutions to move forward and make progress. Acknowledging other perspectives has provided me with the means to learn how to look at certain things in different ways, about people, about our students, about our school as a whole. Even though I am very nervous and anxious to be here today, speaking in front of you, I know exactly how all of you are feeling. And that is, I think, what makes this moment so much more powerful. To look outside of my own fears, my own current bubble, and celebrate you and your accomplishments from this past year, or many years for the doctoral students. As you go out into the real world, you will encounter others who may view things with slightly different lenses. I really think that this will continue your learning, and learning should not end. Even though you all are graduating today, your education should never end. Therefore, I humbly submit to you to keep embracing knowledge, to keep acquiring wisdom. There is a reason why graduations are often called commencements. This day and every other milestone you accomplish in your lives should always be a new beginning, never an end. Congratulations to all of you, class of 2018. Go on and do great things. Thank you. I think I now want to invite Chief Marshal Douglas to the podium to join me to present this year's recipients of the Golden Apple Awards, which are given to faculty members for their excellence in teaching. Each year, the Student Assembly solicits nominations from the student body for these awards. This year, the students selected the following faculty to receive the Golden Apple Award for the excellence in teaching. Our first recipient is Dr. Carlos Castillo Salgado. Our second recipient is Dr. Alvaro Muñez. Our next recipient is Dr. Lorraine Dean. Our final recipient is Tassel, sorry. Our final recipient is Dr. Sydney E. Morris-Dye. And finally, I'd like to also acknowledge the Student Assembly also recognizes faculty for the Advising, Mentoring, and Teaching Recognition Awards. This year's awards recipients are listed in the Convocation booklet. Thank you all, and congratulations again.
Well, thank you, Justin, and I look forward to putting you next year when you graduate? Yep, okay. Delta Omega, the National Honor Society for Public Health, was founded at this school in May of 1924, 94 years ago. Those elected to our chapter, the Alpha chapter of Delta Omega, were inducted at a special ceremony yesterday. The Alpha chapter has created this stole, denoting membership of the Honor Society. And earlier this month, 17 MHA, Masters of Health Administration students, were inducted into Upsilon Phi Delta, the National Academic Honor Society for Healthcare Administrative Programs. And students elected to Phi Beta Kappa were inducted at a ceremony just this morning. In addition, outstanding graduating and continuing students were recognized for special achievements at a wonderful event yesterday afternoon, our annual awards and honor ceremony. The names of the inductees into our honor societies and other award recipients are listed in your program. I ask all awardees to stand and be recognized. And now a very special honor. Ernest Stebbins graduated from our school in 1932 and went on to become the 6th dean of the school. The Ernest Lyman Stebbins Medal was established by an act of the school's advisory board to recognize a faculty member for exceptional contributions to the development of educational programs throughout the school. Conferring of the Stebbins Medal is the highest tribute this school can pay to a member of its faculty. A committee of faculty have selected as the recipient of the Stebbins Medal for 2018 one of the university's most respected and esteemed faculty members, Dr. Joanne Katz. Dr. Katz, could you join me here at the podium? Dr. Katz is a professor in the Department of International Health with joint appointments in biostatistics and epidemiology. Her significant and sustained engagement in developing and maintaining the highest quality educational programs in the department and indeed across the school have contributed deeply to student education for over 30 years. She has been is that good, Ben? She has been a tireless advocate for students while being a demanding but supportive instructor, advisor, and academic program director. In addition to the leadership roles she has taken in curriculum and program development, Joanne has carried out her routine educational activities in a most unroutine manner. She has advised over 25 pre-doc and postdoc students, over 60 master students, and served on more than 100 thesis advisory committees for students across several departments around the school. And she has done this all the time while maintaining her own research and making significant contributions to science and the practice of public health. Please join me in honoring Dr. Joanne Katz. The Dean's Medal is the highest recognition the school confers on public health leaders. It is my honor to bestow this year's Dean's Medal to Dr. Lena Wen, a true public health hero. Dr. Wen, can you join me at the podium? Dr. Wen is the Commissioner of Health for the City of Baltimore. She leads the oldest continuously operating health department in the country, a department with a $130 million budget and over 1,000 employees. Among her very many accomplishments, she responded to surging opioid deaths in the city by issuing a blanket prescription for the opioid antidote, naloxone, to over 600,000 residents of Baltimore. This program has saved over 1,800 lives in the last 3 years. Based on these and other initiatives, Dr. Wen is seen as a national resource, testifying in front of the U.S. Senate and the House, and joining Presidents Obama and Clinton in speaking on the importance of treating addiction as a public health problem. In just a few short years in Baltimore, Dr. Wen has demonstrated that she has the vision of a leader and the heart of an activist. She has been fearless in calling out the role of poverty and racism in major health challenges and innovative in pursuing creative solutions and partnerships to bring about change. Please join me in honoring Dr. Lena Wen. In addition, I am pleased to announce the recipients of 3 prestigious awards who are with us here today. It is important to recognize that these award winners were selected not by just our school, but by and in competition with the entire Johns Hopkins University community. As I call your name, I ask that you please stand and be acknowledged. The Heritage Award honors alumni and friends of Johns Hopkins who have contributed outstanding service over an extended period of time to the progress of a university or the activities of the Alumni Association. Please join me in recognizing a recipient of the 2018 Johns Hopkins University Heritage Award, Dr. David Celentano, the Charles Armstrong Professor and Chair of Epidemiology. Alumni who receive the Distinguished Alumni Award typify the Johns Hopkins tradition of excellence and have brought credit to the university by their personal accomplishments, professional achievements, and humanitarian service. I extend our congratulations to the 2018 Distinguished Alumni Award to our own Michael Clegg, Dean Emeritus and Professor of Epidemiology. The Global Achievement Award honors alumni who exemplify the Johns Hopkins tradition of excellence and have brought credit to the university and their profession in the international health arena through their professional achievements or humanitarian services. Please join me in congratulating this year's awardee, Dr. David Peters, the Edgar Berman Professor and Chair of International Health. Finally, I am delighted to acknowledge recipients of the inaugural Dean's Award for Distinction in Faculty Mentoring, which recognizes faculty members' sustained commitment to excellence in fostering the career success of fellow faculty members in the Bloomberg School. The inaugural awardees of this special honor are Scott Zieger, Professor of Biostatistics, and Val Collada, Professor of Biochemistry and Molecular Biology. Scott's being a little bashful, but there you go. You'll find a complete list of these special honors in your program. I now have the distinct pleasure of introducing our Convocation speaker, Dr. Lena Wen. I have already shared a little bit about Dr. Wen's considerable accomplishments, but there are just a few more things I'd like you to know about her. Under her direction, the Baltimore City Health Department is nationally recognized as an innovator in health solutions. In addition to demonstrating leadership on the opioid epidemic, she has led such efforts as the Be More Healthy Babies strategy that has reduced infant mortality by 38% in 7 years, and the Safe Streets program that hires returning citizens to mediate conflicts and interrupt violence. She also developed a blueprint for health and well-being for Baltimore that enlists all sectors to achieve an ambitious goal of cutting disparities in half in just 10 years. Dr. Wen is an emergency physician, and a patient and community advocate. Among her many recognitions, the Daily Record named her one of the 100 most influential Marylanders, and Modern Healthcare called her one of the country's 50 most influential physician executives. In 2016, she was honored by the American Public Health Association with its highest award for local public health work, the Milton and Ruth Romer Award. And last year, in 2017, she was named one of Governing's Public Officials of the Year. Dr. Wen is an author of the acclaimed book, When Doctors Don't Listen. She has given 6 very popular TED and TED-Med talks, and just to give you an example, her TED Talk on transparency in medicine has been viewed over 1.8 million times. Please join me in giving a warm welcome to Dr. Lena Wen, our friend, our colleague, and a true public health hero. Dr. Wen.
Hello, class of 2018. What an honor to celebrate you, the public health leaders of today and tomorrow. Your school's mission is the cornerstone of public health, saving lives, millions at a time. This is the dedication to being the society's doctor. And it's exemplified through the leadership of your dean, someone I greatly respect and admire, Dr. Ellen McKenzie. Please join me in thanking Dean McKenzie. We celebrate today with your faculty and staff, many of whom I've had the opportunity to work with. From former Dean Michael Clagg to Vice Dean Joshua Sarfstein, all of your faculty are exceptional role models who truly walk the walk of public health. Thank you, faculty, for your teaching, guidance, and mentorship. Graduations hold a special place in my heart. When I was in my second year of medical school, my mother was diagnosed with metastatic cancer. My graduation was the last time that our family was together. I think about my mother every day, especially as I am the new mother myself to a 9-month-old baby. And I think about her today. I think about my mother today as I see all of you surrounded by your loved ones. Your graduation is their graduation too. So to the parents, siblings, spouses, children, and all of your loved ones, thank you for being here today and every day. Dean McKenzie invited me to share some stories from the front lines of local public health. Well, you may know the nickname of the Baltimore City Health Department. We're the agency of bugs, drugs, and sex. So there's a lot of material to draw from. How about week 1 on my job, when we had a suspected case of measles in a 1-year-old? Measles is so contagious that one person who has the disease will infect, on average, 20 other people if they are unvaccinated. So we had to trace every contact this child had. Unfortunately, this was a 1-year-old with a very active social life. She attended, among other events, a birthday party at a Chuck E. Cheese, yes, you can groan, and a retirement party at a nursing home. Or how about when someone broke into one of our animal control vehicles and stole a raccoon in a cage? Well, apparently this thief quickly bored of the raccoon because a 911 call was placed describing a raccoon in a cage being thrown out of a silver sedan. Well, this raccoon subsequently tested positive for rabies, a disease that is nearly always fatal in humans. So this turned from being a law enforcement issue to a public health one, because now we're looking all over the city for the person who stole the raccoon to give them a rabies shot to save their life. On a serious note, let's talk about the opioid epidemic. Last year, here in Baltimore, over 700 people died from overdose. Addiction affects every aspect of our community. And science is unequivocal that addiction is a disease, that treatment exists, and that recovery is possible. Yet nationwide, only 1 in 10 people with the disease of addiction get the help that they need. For what other disease would we ever find this acceptable? Would we say, sorry that you have cancer, but only 1 in 10 of you can get chemotherapy? Or that we should have you put in jail for your diabetes and deprive you of needed medical treatment? There are injustices and inequities everywhere we look, from pervasive stigma to the disparities that are manifest in the 20-year difference in life expectancy across neighborhoods in our city. But for us in public health, we don't just accept the status quo. For us in public health, inaction is never an option. In Baltimore, we got legislation passed such that in October of 2015, I issued a standing order, a blanket prescription for the opioid antidote naloxone to all 620,000 residents. It was the right thing to do, but still a little nerve-wracking to put your signature to 620,000 prescriptions. We quickly discovered, though, that changing policy is necessary but not sufficient unless we provide services to meet people where they are. So we began naloxone trainings in markets, in churches, on street corners. We mapped out where overdoses were occurring to do outreach in real time. And we hired people who are in recovery themselves. In 2.5 years, we've conducted 39,000 trainings. And our most recent data, updated this morning because we believe in data, show that everyday residents have saved 2,072 lives of family members, friends, and fellow human beings. This is my first piece of advice to you graduates. Don't wait. Don't let perfect be the enemy of the good. There are some who have criticized my naloxone program by saying that it's only a short-term fix to the complex problem of addiction. And they're right. We need to work toward longer-term solutions. And we're doing so by starting a stabilization center, a first-of-its-kind urgent care, or ER, for addiction, and changing our criminal justice system to treat rather than incarcerate. And we have to do even more to address the social determinants that fuel ill health and despair, like poverty, unemployment, and homelessness. But while we wait for societal change, how many more people will die in front of us? We have to save lives today for there to even be a chance for better tomorrow. In public health, the problems we face can seem overwhelming. But we must start somewhere because there will be something we can do right now. Don't wait until you have the most well-researched paper or the perfect job, though this is your graduation day, so I do wish you both of those things. Go beyond studying the problem. Be the person who steps up first. Find what you can do and do it now. My second piece of advice to you: don't let others tell you what public health can or cannot do. There are those who told our predecessors that they shouldn't dare to take on the tobacco industry, or that public health has no role in automobile safety or environmental regulation. Well, how many millions of lives are saved today because public health leaders took on those industries and refused to be silenced? Nowadays, there are those who tell us that public health has no role in violence prevention. Really? They haven't treated patients in the ER to see how gun violence is undeniably a health issue. They're not seeing the science that violence spreads like a contagious disease, that interventions like Baltimore Safe Streets program work to mediate thousands of conflicts that otherwise would have resulted in shootings. And they haven't read Dean McKenzie's acclaimed body of research on injury and trauma. But how about going further upstream? A study from the Bloomberg School found that as many as 10,000 of our city's children needed glasses and weren't getting them. 2 years ago, with partners including Johns Hopkins, we launched a program to provide vision screenings for every child in Baltimore. And for all kids who need them, we get them glasses free of charge right in their schools so that they don't have to miss work or they don't have to miss class, and their parents and caregivers don't have to miss work. that's meeting people where they are, acknowledging that nobody should ever be priced out of a basic health intervention. This program, by the way, is called Vision for Baltimore. Other names that were top contenders included Glasses Half Full and Sight for Sore Eyes. Who says that we can't have fun in public health? Although you can tell me about the fun in store for you when you toast your non-sugar sweetened beverage, non-alcoholic beverage after driving at or below the speed limit to your destination. It's been said that public health works best when we are invisible. But if we are invisible, nobody else will make the case for us. And then what happens? When it comes time to decide the budget, public health will be the first item on the chopping block. You need to be that constant voice to talk about how eliminating preparedness means uncontrolled outbreaks, how gutting Medicaid has devastating impacts for pregnant women and children and generations to come, how cutting corners in environmental health is called flint. You have to put the face on public health. It would be nice if doing good research and running great programs is enough to convince policymakers. It's not. As Senator Barbara Mikulski says, data validate, they don't motivate. You need to be the motivator. You need to make public health visible. You will face setbacks along the way. Last July, Baltimore City received notice that our 5-year grant from the U.S. Department of Health and Human Services for teen pregnancy prevention would be cut 2 years short. This was a $3.5 million reduction that would eliminate evidence-based, science-based reproductive health education for 20,000 middle and high school students. Despite many requests, we received no explanation for the cut, though you can hazard your best guess. Our staff were outraged, shocked, and discouraged. But there is no room in public health for pessimists. There is no room in public health for passive observers. So, the city of Baltimore filed a lawsuit against the Trump administration. And last month, we heard that we won. We have to take action, and we cannot let anyone else limit the reach of what public health can or cannot do. Here is my third and final piece of advice. Stand up and speak up. These are challenging times we live in. Many of us in this room are immigrants. I was 8 years old when my parents and I came from China to the US. A few days before our immigration status was going to run out, we were granted political asylum. If we weren't so lucky, I would have been a dreamer. I don't know where I would be now, but I'm pretty sure that I wouldn't be standing here giving your convocation address as the Health Commissioner of Baltimore. Every day, we advocate for policies and deliver services that peg us to a particular ideology. For me, that's expanding needle exchange, providing the full range of reproductive health care, suing President Trump. I've been told to go back to my own country, which is the United States of America, and there have been death threats delivered to my office and to my home. But being a public health leader requires the willingness to stand up and to speak up. At a recent community event, someone asked me to explain the opioid epidemic. This gentleman was in his 40s, and he asked me to explain why the opioid epidemic is suddenly this crisis, this epidemic, this public health emergency, when there has been a state of emergency around opioids his entire life. And you know what? He's right. When addiction affected poor minorities in inner cities, it was seen as a choice, a moral failing. So if they end up incarcerated or dead, it was their fault. But now that addiction affects white, affluent communities, it's called a disease. Don't get me wrong, we need far more treatment for this disease. And this understanding is long overdue, but we cannot begin addressing this issue unless we are honest and speak the truth about the structural racism and the deep-seated inequities that got us to where we are. We must speak the truth that there are entire generations of Black and brown people to whom we owe an apology. And we must speak the truth that just as poverty and violence are public health issues, racism is a public health issue. Now, these are not easy things to speak about, but you must do it. Public health demands courage. Public health demands speaking the truth. Today, you are being conferred a prestigious degree from a prestigious institution. In fact, I'm reminded, the #1 school of public health. All of you have worked hard for this privilege. But along with the privilege comes the responsibility to take risks and the courage to follow your conscience. Standing up for public health, for the public's health, means that you will always be on the right side of history. I'd like to end today with a quote from civil rights activist and scholar Benjamin Mays. I only have a minute, 60 seconds in it. Forced upon me, I did not choose it, but I know that I must use it. Suffer if I lose it, give account if I abuse it. Only a tiny little minute, but eternity is in it. Graduates, public health practitioners, academicians, and leaders, let's take the minutes that we have. Don't wait. Let's take action now. Don't let others tell you what public health can or cannot do. Let's make the case for how public health saves lives and counters disparities and injustice. Don't hesitate to embrace the challenges and the risks. Let's stand up and speak up and serve with courage, action, and urgency. Thank you for the honor to join you today on this amazing, joyous occasion. Congratulations to Dean Mackenzie, faculty, and staff for carrying on the tradition of this remarkable institution. Congratulations to the parents, friends, and family for supporting these dedicated public health leaders. And to the graduates, I applaud you, I celebrate you, I cheer you on in your journey to save lives, millions at a time. Congratulations, class of 2018.
Thank you, Dr. Nguyen, for that inspiring address. Before graduates receive their hoods and diplomas, I invite Allison Giddings to lead the class in the recitation of the International Declaration of Health Rights. The document, composed by faculty and students on the occasion of the School of Public Health's 75th anniversary, expresses the deepest aspirations of public health professionals and scientists. A special printing of the declaration is available to each of this afternoon's master's graduates after the ceremony. Doctoral graduates will receive their declaration from Dean McKenzie as part of the hooding ceremony. The declaration appears on the last page of your program. Will the 2008 graduating class please stand to recite the declaration?
Please speak along with me. We, as people concerned about the health improvements in the world, do hereby commit ourselves to advocacy and action to promote the health rights of all human beings. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. It is not a privilege for those with power, money, or social standing. Health is more than the absence of disease, but includes the prevention of illness, development of individual potential, a positive sense of physical, mental, and social well-being. Healthcare should be based on dialogue and collaboration between citizens, professionals, communities, and policymakers. Health services should be affordable, accessible, effective, efficient, and convenient. Health begins with healthy development of the child and a positive family environment. Health must be sustained by the active role of men and women in health and development. The role of women and their welfare must be recognized and addressed. Healthcare for the elderly should preserve dignity, respect, and concern for quality of life and not merely extend life. Health requires a sustainable environment with balanced human population growth and preservation of cultural diversity. Health depends on the availability to people of basic essentials: food, safe water, housing, education, productive employment, protection from pollution, and prevention of social alienation. Health depends on protection from exploitation without distinction of race, religion, political belief, economic, or social condition. Health requires peaceful and equitable development and collaboration of all peoples. Thank you.
Thank you, Ms. Giddings. The graduates who will be awarded the degree Master of Applied Science, Master of Arts, Master of Bioethics, Master of Health Administration, Master of Health Science, Master of Public Policy, Master of Science in Public Health, and Master of Science will now be presented with their diplomas. We request that the audience hold applause for individual graduates and applaud instead following the groups of graduates in degree programs. We also ask that graduates remain seated until the end of the ceremony. Additionally, we remind guests that each graduate will have his or her picture taken as they receive their diplomas. Master's graduates should note that these are the real diplomas. Treat them with care. After the ceremony, diploma tubes will be available to you in the concourse lobby. Will the Master of Applied Science and Master of Arts candidates seated in rows A and B please rise and form a procession in the aisle to your right? Dr. Golub, please come to the podium to announce the graduates.
Will the graduates who will be awarded the degree Master of Applied Science come forward to receive your diplomas as your names are called? Anina Aaron. Shrikanta Banerjee. Patrick Chen. Thomas Crumpton. Kristen Fawnin. John Gray. Jared Hansen. Victoria Gent. Mingxuan Li. Ivy Moondance Mar. Sharon Murphy. Michael Nozel. Emily Louise Roseman. Michael Robert Ruppel. Sandy Salavares Bodner. Kiyi Shi. Kathleen Skeed. Gwendolyn Woodward. On behalf of the school and the university, I would like to congratulate the school's first class of Master of Applied Science graduates. Will the graduate who will be awarded the degree Master of Arts come forward to receive your diploma? Michelle Eric. On behalf of the school and the university, I would like to congratulate the school's first Master of Arts graduate. Will the graduates who will be awarded the degree Master of Bioethics come forward to receive your diplomas? Sarah Celeste Antonacci. Ida Osmelash. Iris Coates McCall. Mitra Hashemi Haeri. Claire Elise Mena. Matthew Morgan. Yoichiro Oka. Caitlin Marie Veely. On behalf of the school and the university, I would like to congratulate the most recent class of Master of Bioethics graduates. Will the graduates who will be awarded the degree Master of Health Administration come forward to receive your diplomas? Tolga Babur. Noah Chang. Zafreen Farishta. Julie Ann Finstermaker. Natalie Fong. Allison Ann Hart. Stacy Hodge. Elizabeth Haymoon Hoang. Jameson Nicole Kais. Hayin Esther Kim. Evan Takaji Kitaka. Lindsay Ray McMurdy. Sarvesh Naluri. Valentina Opris. Stephen Ross Sedami. Bernadette Senden. Michelle Shum. Christopher James Solmonti, Jr. Benjamin David Thompson. Sandra Diane Wetzel. Carrie Zhuang. On behalf of the school and the university, I would like to congratulate the school's most recent group of Master of Health Administration graduates. Will the graduates who will be awarded the degree Master of Health Science come forward to receive your diplomas? Zafir Abu Talib. Yonit Adise. Selma Ahmed. Jennifer Ann Aldous. Demi Alfonso. Kavia Anchuri. Tierra Darlene Askew. Michaela Bartholmus. Ana Bengoechea. Asta Berry. David Boama. Christina Asher Bradley Meyer. Matthew Alexander Brown. Tiara Dawn Burrell. Rahul Ravi Chander. Han Chen. Nancy Chen. Yutong Chen. Ji-Won Choi. Sumi Chung. Casey Costello. Girvani Dagupati. Avery Das. Anthony DeFelice. Emily Grace Deal. Simo Du. James H. Engel, Jr. Marie Vianne Dino Espiritu. Roberta Florido. Grace Kryl Foster. Johanna Germain. Allison Denise Gittens. Leanne Goldberg. Victoria Rachel Green.
Sorry. Thank you. Siri Guntupali. Viuego. Thank you. Judy Ha. Joey Maurice Michael Harmon. Thank you. Alex Heglin.
Ellen Danyu Hu. Thank you. Mohammed Hudhud. Jessica Iyer. Thank you. Jane Baruch Jeffrey. Thank you. Rekha Kambampate. Lacey Kaplan. Thank you. Marcella Austin Kelly. Cynthia Caniza. Adrienne Eluna Kramer. Chiwan Lee. Thank you. Tenzin Chunzi Laksampu. Chen Liang. Thank you. Yifei Liu. Thank you. Yiquen Luan. Nicholas Lukash. Singyun Law. Omar Mansour. Casey Manzanero. Weizheng Mao. Thank you. Lena Molly Matthews. Ariel Emmanuel Matsakos. Naruka Nkiruko Makolo. Kevin Mortazavi. Jennifer Danielle Motter. Sanjuna Morley. Zoa Nasir. Joanne Duco Gumba. Sorry. Deborah Obehi Odihi. De-ung-o. Derek Leonel Osario Luciano. Stephanie Wynn Pham. Wendy Piedra. Sri Lakshmi Rajeware. Unjana Rao. Ashna Thamarapakon Rao. Wajiha Raza. Shauna Marie Renworth. Cassidy Roby. Serena Angelica Roque. Bryce X. Rowan. Thank you. Anaga Sadashivan. Rebecca Rothenberg Seltzer. Raquel Sarua. Megina Runjith Shetty. Kirsty Mary Jane Spigwright. Surtaj B. Singh. Thank you. Prithvi Sinha. Sarah So. Jessica S. Sun. Dia Song. Catherine Allison Somerton. Connor Svetley. Melody Augustina Swen. Shu Ting Tao. Jay Thakor. Matthew Thomas. Naikaichi Uzu'ukwu. Shamli Ramash. Eugenia Wong. Stephanie Xavier. Shengxia Xu. Yuingwan Zhu. Jemin Yao. Christopher Yi. Yuxuan Yo. Jeffrey Yu. Yifan Yu. Mingyu Zhang. Sinren Chow. On behalf of the school and the university, I would like to congratulate the most recent group of Master of Health Science graduates. Will the graduates who will be awarded the degree of Master of Public Policy come forward to receive your diplomas?
Colson K. Campbell. Ari Adam Davis. Eleanor Evans. Lashanthi Fernando. Danielle Renee Gilmore. Xue Yu. Rachel Keller Landis. Joy J. Lee. Caitlin Page Spear. Catherine Nancy Walsh. Lindsay Wong. Jingwang Ye. Huaying Chung. On behalf of the school and the university, I would like to congratulate the most recent group of Master of Public Policy graduates. Will the graduates who've been awarded the degree of Master of Science in Public Health come forward to receive your diplomas? Cara Antonocchio. Oluwatamilori Olamide Ariola. Julia Catherine Bennett. Laurie A. Betcher. Anna Bickers. Arlene Bignamara. Emma J. Brofsky. Carolyn Jean Brown. Emily Bryce. Megan Elizabeth Byrne. Eileen Cervantes del Toro. Renee Chanis. I'm sorry, Rebecca, pardon me, Rebecca Chanis. Ashley Marie Cherist. Alameyu Priya Chidambaram. Belinda Chin Chu. Rachel Collar. Virginia Cooper. Anita Dom. Mindy De Paula. Crystal El Kupti. Uralix Estrada. Ashley Maria George. Emil Hafiz. Danielle Lois Hansen. Gabrielle Hedrick. Jennifer Henderson. Jae Honey. Shakir Hosen. Aniqua Islam. Livia Frazo Jaramillo. Mary Elizabeth Farrell Jiris. Digna Martha Kakanutu. Bia Kong. Elizabeth Haiwan Kong. Taban Khan. Rucha Kunte. Sarah Kim. Shannon King. Julia Margaret Kudratic. Sylvie Rose Lusan. Esther Lee. Brenton Ling. Shay Jewel Littlepage. Lauren Taylor Longo. Haley Lucet. Harry Liu. Janelle Magnapantai. Afreen Mahmood. Simon Arun Marshall Shaw. Cameron Stewart Mead. Kenneth Brian Morales. Emily Michelle Nagurney. Abigail Neal. Madeline Nelson. Meredith Bertel Nicholson. Janyi Ne. Famana Nishath. Habiba Oguthande. Lauren Pomley. Hema Patel. Maria Chipti Patwa. Walter Page Peoples IV. Michael Peters. Congratulating Michael is his father, Dr. David Peters, chair in the Department of International Health, and his mother, Dr. Karen Neufeld, faculty in the School of Medicine. Yeah, no kidding. Wesley David Peters. Apparently no relation. Christina Christos Pasoulis. Summer Rack. Aditi Rao. Nichaya Ratanupreyu. Matea Christiana Romer. Joseph Gregory Rosen.
Hadisa Saad. Anna Sefer. Umrita Saha. Serena Numura Shat. Denise Scheller. Laura Michelle Senna. Felicia Jesselyn Setiono. Allison Schaefer. Kenari Milap Shah. Maisa Siddiq. Akshita Sedali. So Yoon Sim. Sarah Sullen Hanover. Elizabeth Marie Stone. Kathleen Taylor. Jen Nicole Theed. Laura Telusa Leva. Jacqueline Tran. Akshara Valmikanathan. Nikita Catherine Viswasan. Umira Elisa Wadi. Jasmine Rose Walker. Yahu Wang. Dexter Waters. Olivia Wen. Rebecca Hamilton White. Abigail Kimberly Winokur. Ryan Michelle Woolley. Jessie Lee Wright. Benwin Wu. Emily Young. Jacqueline Young. Wen Lei Young. On behalf of the school and the university, I'd like to congratulate the most recent group of Masters of Science and Public Health graduates. Will the graduates who will be awarded the degree of Master of Science come forward to receive your diplomas? Benjamin William Barrett. Fiona Bondukan. Jennifer Erin Brophy. Yu Tsao. Chi Kai Chang. Mukjin Chen. Megan Elizabeth Chestnut. Alicia Rokia Chudri. Gaurav Diamond. Alicia Lenore Ellison. Kira Mary Engel. Jeji Gui. Bixi He. Zhang Jie Zhung. Sharzad Kayat. Shuzhen Li. Sujin Lim. Scott Meredith. Nguyen Dao. Isha Pundia. Tanvi Padluri. Monali Prahadraj. Shulin Ching. Maria Laura Ratuega Via Irada. Abby Rosado Rivera. Ian Francisco Sanchez. Ji Shi. La Xing Song. Owen John Stokes Colley. Emily Jean Thompson. Ryan Jack Vinama. Raghav Vij. Wang Runchi. Zhu Shu. Andrew Harold Young. Fang Cheng Yuan. Shuqi Zhou. Feiyang Zheng. Yeya Zheng. On behalf of the school and the university, I'd like to congratulate the most recent group of Master of Science graduates. Will the graduates who will be awarded the degree of Master of Public Health come forward to receive your diplomas?
So wait right here. Wow. Before we get to the MPH class, anybody want to join me in a public health stretch? Do I have any volunteers to come forward, perhaps? Can I get a little help in the room, please? Everyone ready? Raise your hands for sky-high vaccination rates. Okay. Down, down, down goes the incidence of sexually transmitted disease. infections, right? Up, up with evidence, facts, and science. Okay, now brush off the fake evidence, the fake facts, and the fake science. To the right, to engage the private sector. To the left, to confront the root causes of disease. Next, reach out laterally and greet your neighbor to reduce the prevalence of social isolation. Okay, now take a deep breath to contemplate the joy of public health and of this moment. And clap for the graduates. Thank you very much for joining me. You may now be seated. And we continue. Thank you for your patience. Saad Abdelaziz. Tayawa Aguns. Shayan Ahmed. Barak Al-Ahmad. Yardley Felix Abarasin. Riyad Q. El-Ghamdi. Joe Amua. Jennifer Anderson. Caitlin May Arena. Osman Aslam. Larissa Assam. Oye Atambe. Simona Atanasova. Ariola Abiola Ayedun. Hannah Bao. Thank you. Christian M. Baingana. Raymond Anthony Bellarmino. Ashwin Ejaman Beludi. Michael Benusek. Vinayak Bardwaj. Miriam Bouya. Samira Brooks. Margaret Asa Burns-Rath. You can see. David Michael Buxton. Ariel Madeline Caldwell. Vito Castlegrand. Kashik Chakraborty. Rachel Chamanga Kayenda. Joseph Shiaib. Xiang Hing Go. Grace Chiang. Zhang Ah Cho. Maisoon Chowdhury. Merither Chuidian. William Hampton Coe. Emma Elizabeth Kogan. Haley Ann Cox. Hannah Cranford. Jonathan Reed Crow. Michael Cunningham. Alexa Curhan. Trisha De Silva. Stacy Dalpas. Mohammed Darwish. Mandy Cien David. Danielle Rose DaCosta. Shreya Desai. Carol Dixon. Bao Tram Do. Priyam Tashar Doshi. Sarah Nixon Dudgeon. Katrina Duncan. Shabnam Durrani. Xinuan Chang. Erin Rochelle Beachy Eby. Bernadette Marie Eichmann. Hannah Lynn Ellison. Olufemi Akinwunmi Enriosho. Cynthia Felix. Kusi Faradas. Eleanor Fiddle. Aspen Dawn Flynn. Anya Catherine Fries. Shika Gandhi. William Garrett. Fatima Kadimi. Arti Garpure. Amelia Josephine Goldsmith. Julia Patterson Group. Monica Guerrero Vasquez. Merve Gorakar. Anne-Marie Gustafson.
Stacy Allison Harcum. Shreya Haryani. Rachel Hartzell. Christine Hogg. Lauren Havens. Elise Hibb. Kelly Marie Hilovsky. Michelle Lee Holshoe. Bailey House. Sarah Catherine Hoyt. Maria Salim Ibrahim. Haluhiko Inada. Allison Faye Isaacson. Alexandra Istel. Nikki Jafari. Mara McKenna James. Caitlin Jelinek. Sarah Jane Kahn. Takako Kanakubo. Radha Kanaganti. Oshin Kanwar. Laura Frances Keenan. Isra Khan. Muskan Khosla. Young Shin Kim. Ken Kitayama. Alana Beth Knight. Aparna Krishnan. Sarah Kin Koo. Hironori Kuga. Jennifer Kuhl. Justina Kwan. Soyeon Kang. Sarah Lefebvre. Andrew Lewis Lawn. Nicole Elizabeth Lightman. Kate Lipstein. Albert Jiang Liu. Jennifer Lund. Needy Madan. Nuna Makarova. Mackenzie Krauser Manny. Ingrid Elizabeth Maravilla. Hannah Catherine Marker. Tomomi Matsushita. Leslie Grady McAaron. Jasmine McClendon. Pamela McDonald. Amy Quinlan McDonough. Anne Holbrook McKenna. Emily McPhee. Craig Stewart Merriman. Shazneen Barjor Mehta. Toby Merck. Erica Mills. Jessica Morano. Lukman Mojid. Chirubem Wamaka Mama. Agostino Moreira de Sousa. Andrew Mold. Stephanie Louise Musi. Fadi Murad. Shinsuke Muto. Geeta Nadimpali. Vasantha Kumar Namasivayam. Nobutoshi Nawa. Mila Neira. Ivan Muchipai Ngalula. Abiral Nidhi. Alejandro Ochoa III. Rashidat Ake. Adobe Chisomu Okonkwo. Owen Joseph O'Neill. Albert Danso Ose.
Catherine Pahigianis. Jin Young K. Park. Nishi Patel. Ashok Babu Patibandla. Nithin Paul. Emily Catherine Pedersen. Angela Pehar. Rachel Anastasia Pellegrino. Jinfeng Peng. Abir Pevars. Lindsay Peters. Amy Lynn Peterson. Donna Fantrin. Rachel Pinto. Cameron Pollock. Sandeep Prabhu. Austin Joe Price. Rahul Raj Kumar. MD Sohel Rana. Lavanya Rowe. Amanda Wallen. Abigail Reich. Rahana Rizivi. Seema Rizivi. Paul Joseph Rogers. Jeffrey Eric Rollman. Anne Rosenthal. Baha Rashamanish. Cindy Nana Abba Sago. Dima Sahab. Ahmed Saleh. Elizabeth Ann Salerno. Anna Sandi. Kavya Sangvi. Prithvi Raj Sankla. Johannes Benedict Shepek. Kirsten Schlauser. Tea Scolemilio. Latrice Searson Norris. Ahmed Shakarchi. Aaron Shapiro. Ruchi Shrestha. Jeremy Siegel. Joseph Segrin. Tanea Singh. Joshua Skaggs. Annie Smith. Christy Smith. Silverly Singone. Salma Sparklin. Varuna Srinivasan. Bismaraj Srivastava. Ahmed Taher. Sandra Tolera. Tam Waijia. Tanyanan Tana Wati Wat. Oswald Ni Mamana Tete. Amelia Galley Thurber. Kawaia Nuyu TJ. Frederick Toll. Huang Trin. Shreya Tulsiani. Becky Twombly. Chibuzo Uwakename. Vanitra Varadarajan. Deepti Venkataraman. Judith Bina Vick. Andrea Sullivan Wallach. Lei Wong. Warogaro Wanzhou. Jackson Dean Ward. Timothy Werwe. Jessica Whitley. Jasmine Teresa Wilding. Ashley Michelle Williams. Romina Wingert. Bethel Woldu. Kate Wright. Lingzi Su. Yingche Huang. Akihito Yoshida. David Yu. Sile Yu. Yao Yuan. Kira Zagaya. Salvia Ijaz Hussein Zijan. Zara Zanali. On behalf of the school and the university, I would like to congratulate the most recent group of Master of Public Health graduates.
Recipients of the doctoral degrees will be presented with their diplomas on Thursday at the university commencement ceremony. We are pleased to have them participate in these exercises this afternoon so that they may receive their Declaration of Health Rights, doctoral hoods, and our congratulations. Conferring the hoods will be the chair of the department in which the candidate's work was done. Will the graduates who have been awarded the degrees of Doctor of Philosophy, Doctor of Public Health, and Doctor of Science come forward as I read your names? Hooding the doctoral graduates from the Department of Biostatistics is Dr. Karen Bandine Roche, Chair and Professor of Biostatistics. Datian Deng, Doctor of Philosophy. Yu Du, Doctor of Philosophy.
Okay.
Jack Fu, Doctor of Philosophy. Emily Huang, Doctor of Philosophy. Dan Jiang, Doctor of Philosophy. Sandra Renee De Brito, Doctor of Philosophy. Sapna Ravi Kudchadkar, Doctor of Philosophy. Congratulations to the most recent doctoral graduates from the Graduate Training Program in Clinical Investigation. Hooding the doctoral graduates from the Department of Environmental Health and Engineering is Dr. Marcia Wills. So it's graduate training program. Next, we will have the graduates from the Graduate Training Program in Clinical Investigation. It's not what we've got here. Environmental health? Yes. Sorry, it's environmental health. Yeah. Hooding the doctoral graduates from the Department of Environmental Health and Engineering is Dr. Marcia Wills-Karp, Chair and Professor of Environmental Health Sciences. Mina Mohammed Aladdin, Doctor of Philosophy. Chris-Anne Cronin, Doctor of Public Health. James Brian Harmon, Doctor of Philosophy. Thamasing Ingvaya, Doctor of Philosophy. Merica Carmen Livingston, Doctor of Philosophy. Congratulations to the Department of Environmental Health and Engineering and its most recent doctoral graduates. Hooding the doctoral graduates from the Department of Epidemiology is Dr. David Celentano, Chair and Professor of Epidemiology. Jim Katuku Aizere, Doctor of Philosophy. Martha Brucato, Doctor of Philosophy. Chelsea Kanan, Doctor of Philosophy. Jeff Doherty, Doctor of Philosophy. Youssef Mohammed Kamal Farag, Doctor of Philosophy. Nicole Fusco, Doctor of Science. Gillian Gresham, Doctor of Philosophy. Marisa Hast, Doctor of Philosophy. Lauren Hurwitz, Doctor of Philosophy. Hai Young Kim, Doctor of Philosophy. Alexander Catherine Lee, Doctor of Philosophy. Chiadi Erickson Undumele, Doctor of Philosophy. Sally-Ann O'Kiley Pepra, Doctor of Philosophy. Talia Kwandalesi, Doctor of Philosophy. Cody Raymond, Doctor of Philosophy. Hilary Ann Robbins, Doctor of Philosophy. Hilary is also receiving the MHS degree from the Department of Biostatistics. Megan Wallace, Doctor of Public Health. Bethany Warren, Doctor of Philosophy. Congratulations to the Department of Epidemiology and its most recent doctoral graduates. Hooding the doctoral graduates from the Department of Health, Behavior and Society is Dr. Margaret Ensminger, Interim Chair and Professor of Health, Behavior and Society. Jifa Isi Ojay Bewonyo, Doctor of Philosophy. Rami Haya Ek, Doctor of Philosophy. Zoe Mistral Hendrickson, Doctor of Philosophy. Serena Roslyn Eisenberg, Doctor of Philosophy. Kriti Munjal Jain, Doctor of Philosophy. Anna Matam Leddy, Doctor of Philosophy. Ryan Lee, Doctor of Philosophy. Elizabeth Nessoff, Doctor of Philosophy. Ratha Rajan, Doctor of Public Health. Pamela Trangenstein, Doctor of Philosophy. Katie Odette Washington Cole, Doctor of Philosophy. Congratulations to the Department of Health, Behavior and Society and its most recent graduates. Hooding the doctoral graduates from the Department of Health Policy and Management is Dr. Colleen Barry, Chair and Professor of Health Policy and Management.
Farida Ismail Al-Hosani, Doctor of Public Health. Nisha Vasantha Kumar Bhatt, Doctor of Public Health. Mei Ju Chuang, Doctor of Public Health. Mitchell Doucette, Doctor of Philosophy. Rachel Elizabeth Faby, Doctor of Philosophy. Molly Jarman, Doctor of Philosophy. Taruja Deepak Carbunker, Doctor of Philosophy. Paula S. Kent, Doctor of Public Health. Hyo-jung Kim, Doctor of Public Health. Paloma Navas Gutierrez, Doctor of Philosophy. Megan McGuire Priolo, Doctor of Public Health. Shin-Yi Tsai, Doctor of Public Health. Rosa Vasin, Doctor of Philosophy. Deborah Waltermeyer Burton, Doctor of Public Health. Yiling Wu, Doctor of Public Health. Ya-Ting Young, Doctor of Public Health. Wei Cheng Yao, Doctor of Public Health. Wu Kuo Yen, Doctor of Public Health. Congratulations to the Department of Health Policy and Management and its most recent doctoral graduates. Putting the doctoral graduates from the Department of International Health is Dr. David Peters, Chair and Professor of International Health. Sania Ashraf, Doctor of Philosophy. Lauren Elizabeth Brown, Doctor of Philosophy. Karen Ting Chang, Doctor of Philosophy. Dorothy Tomiko Chu, Doctor of Philosophy. Elizabeth Marie Shimalaysky Yi, Doctor of Philosophy. Amber Bickford Cox, Doctor of Philosophy. Amanda Driscoll, Doctor of Philosophy. Daniel Joseph Erchik, Doctor of Philosophy. Christina Reyes Garcia, Doctor of Philosophy. Wenfeng Gong, Doctor of Philosophy. Wenfeng also received the MHS degree from the Department of Biostatistics. Yuen Y. Hung, Doctor of Philosophy. Avril Dawn Kaplan, Doctor of Philosophy. Joanna Lai, Doctor of Public Health. Tsering Pama Lama, Doctor of Philosophy. Molly Elizabeth Lassiter, Doctor of Philosophy. Adi Neumann, Doctor of Philosophy. Chike William Nwanengwu, Doctor of Public Health. Samira Sami, Doctor of Public Health. Catherine Shelley, Doctor of Philosophy. Sharon Choi, Doctor of Philosophy. Brian Patrick Wall, Doctor of Philosophy. Fan Young, Doctor of Philosophy. Congratulations to the Department of International Health and its most recent doctoral graduates. Putting the doctoral graduates from the Department of Mental Health is Dr. Danielle Fallon, Chair and Professor of Mental Health. Yura Lydia Sarkis Agustina Vicious, Doctor of Philosophy. April Joy Guriba Damian, Doctor of Philosophy. David Olawuyi Fakunle, Doctor of Philosophy. Luther Gregory Kalb, Doctor of Philosophy. Chang Shu, Doctor of Philosophy. Chang is also receiving the MHS degree from the Department of Biostatistics. Emma Kilvington Stapp, Doctor of Philosophy. Congratulations to the Department of Mental Health and its most recent doctoral graduates. Putting the doctoral graduates from the Department of Molecular Microbiology and Immunology is Dr. Arturo Casadeval, Chair and Professor of Molecular Microbiology and Immunology. June Lily Chand, Doctor of Philosophy. Ashley Nelson, Doctor of Philosophy. Aaliyah Roberts, Doctor of Philosophy. Philip Salvatore, Doctor of Philosophy. Leah Ashley Walker, Doctor of Philosophy. Congratulations to the Department of Molecular Microbiology and Immunology and its most recent doctoral graduates. Putting the doctoral graduates from the Department of Population, Family, and Reproductive Health is Dr. Cynthia Minkovitz, Chair and Professor of Population, Family, and Reproductive Health. Suzanne O'Day Bell, Doctor of Philosophy. Amanda K. Gatewood, Doctor of Philosophy. Anne Catherine Herbert, Doctor of Philosophy. Ji Yuelong Ji, Doctor of Philosophy. Roxanne Mirabal Beltran, Doctor of Philosophy. Lauren Jessie O'Connor, Doctor of Philosophy. Balanle Olapeju, Doctor of Philosophy. Ramkripa Raghavan, Doctor of Public Health. Congratulations to the Department of Population, Family, and Reproductive Health and its most recent doctoral graduates. Please join me in congratulating all 153 doctoral graduates from the Johns Hopkins Bloomberg School of Public Health, class of 2018.
Before concluding the ceremony, I wish to take this opportunity to welcome each member of this year's graduating class into the Global Alumni Network of the Johns Hopkins Bloomberg School of Public Health. As alumni, you are vital to that future. Our graduates are the school's most valued ambassadors in almost every state in this country and many nations around the world. Additionally, you automatically become a member of the Johns Hopkins University Alumni Association. As members of the Global Alumni Network of the Johns Hopkins Bloomberg School of Public Health, you are part of the history of the oldest, largest, and #1 school of public health. You join the ranks of those like Antonio Novello, Alexander Longmire, Tim Baker, George Comstock, D.A. Henderson, Al Sommer, Michael Clegg, and our dean, Ellen McKenzie. Our Global Alumni Network pushes the agenda of public health by expanding its boundaries, launching new discourses, and taking on the big problems. From the very latest research to networking events, from key conversations to regional programming, do not miss out on those opportunities unique to our alumni. Stay connected and get involved by maintaining your contact information with the school. Just visit the alumni section of the school's website to update your contact information. This concludes the ceremony. I would like to take this opportunity to thank all those faculty, students, and staff who assisted this afternoon. I would also like to remind all doctoral graduates who are not attending Thursday afternoon's commencement ceremony that a regalia return station is set up on the lower level. Master students may keep or recycle their regalia. I ask that guests remain in their seats until all faculty and graduates have exited. Graduates, your marshals will lead you out after faculty have exited the stage. Will the graduates, faculty, and honored guests please rise?